Hey, it's Rachel Shelby here, and I'm here to talk about my TED Talk for South Africa. One of the things about South Africa is that they have one of the highest maternal mortality rates in the world, with 119 deaths per 100,000 live births. Let's think about that for a minute. In the United States, we only have 17.4 deaths per 100,000 births. That is a huge difference. Part of the reason they have such a high maternal mortality rate, it's due to the high incidence of HIV and AIDS in South Africa. It's also due to non-pregnancy related infections because of HIV and AIDS. It's also due to post-delivery infection and post-delivery hemorrhage. There's just not enough medical providers in South Africa. Imagine not having any of the comforts of a clinic to be able to take care of you. Like, for example, this clinic here, we have a bed, we have running water, we have instruments to take blood pressure and to monitor vital signs. Some of these women live in a very rural area and don't have the comforts of a medical facility or clinic, or even have skilled birth attendants or even a midwife or someone to take care of them. So the Sustainable Development Goals, they want to lower the maternal mortality rate to less than 70 deaths per 100,000 live births. Skilled health providers are desperately needing, and health education is needed to reduce the morbidity and mortality associated with women of childbearing age in small villages. There is a provider shortage, with only 17% of the population using a private sector hospital. They have the majority of the physicians. They have 70% of the providers and physicians work in the private sector, which leaves the other 86% of people with a very small percentage of healthcare providers. So with $2 million, what I would like to do is I would like to develop a training program for midwives and skilled birth attendants. Rural areas desperately need healthcare providers and education for women. There is a huge healthcare inequality and lack of providers. And let's face it, I know providers go where the money is, so that's why they're working in private care. But 85% of the population need the public sector and charity systems due to the high levels of poverty and for the care. So my goal is to put up the providers to a public sector that need it. We need to develop a midwife training program. And I think by partnering with a local university that trains medical students, not only would students be able to learn and train in these areas, but would also be able to provide care to the public sector that truly needs it. We also need to educate and teach women in the villages to be able to become a skilled birth attendant. What if we gave a woman in a village who wants to help her own community a motorbike, a cell phone, a medical kit, and training to be able to help women in her own area and to be able to transport or get them places if things were out of hand? Women are disregarded in South Africa with a high incidence of poverty, unemployment, and they're subjected to violence regularly. We need to end or help to close that gap by providing a health center for women where they feel secure and safe and are able to receive medically necessary care that should be offered to everyone and not just a private sector. According to a study by Tolsma, Nolte, and Temen in 2016, many women expressed isolation during labor, birth, and postpartum, and lack of social support throughout their process, having at public and private facilities. They also reported lack of resources, stories of sleeping on the floor after they've had their baby, bleeding, angry attendants because they've delivered 30 babies in 24 hours. We desperately need to help these women. Having skilled birth attendants and more midwives in these areas can help alleviate the loneliness a woman might feel, as well as provide the care that she needs. According to the medical journal in Lancet, midwives could prevent more than 80% of maternal and newborn deaths in the world. Filling dangerous gaps in obstetric services with midwives and skilled birth attendants is necessary. The World Health Organization, UNICEF, UNFPA, and ICM have developed international standards to educate midwives to help provide quality care. By partnering with a university, we could use this $2 million to expand training programs and to provide the women with the motorbikes, the cell phones, to be able just to lower this maternal mortality rate. Women are already subjected to so much in South Africa, and we truly need to close that gap and to promote life. Thank you.